plan. The presenters will be Dr. Tewabetch Negatu and Robert Hines with planning and performance, at the Louisiana Department of Health. You can read the description for this session along with their bios on pages 17 and 18 of the conference booklet, which is linked in the chat. So whenever you guys are ready, you can take it away.
Thank you so much, Ms. Henry. I'll go ahead and start and then turn it over to Dr. Negatu. My name is Robert Hines. I am the Deputy Director with the Louisiana Department of Health, Office of Public Health, Bureau of Planning and Performance. Just a little bit about myself. I am an African-American male. I have glasses, short afro. I'm wearing a brown blazer with a black shirt. My mother says I'm handsome. I don't know what that counts for anything, but it may or may not be true. And that's a little bit about myself. I'll turn that over to Dr. Negatu.
Hello, everyone. I am Tewabetch Negatu, the Implementation Manager for the State Health Assessment and State Health Improvement Plan here at the Louisiana Department of Health. I'm a 35-year-old Ethiopian American woman with dark brown wavy hair, and today I'm wearing a navy blue Louisiana Department of Health t-shirt.
Excellent. And with that being said, I will go ahead and share my screen. And we will start the presentation today. Perfect. Okay. So today we have a few learning objectives. The first objective will be demonstrating some examples and strategies of strategies and tools and methods that we've used to engage the community members around the state health improvement plan development. We'll demonstrate what we think is effective implementation of those strategies and tools to actually develop the goals and objectives of the plan, to demonstrate the impact of engagement efforts on community members, and also to describe the importance of reliable data and reliable data sources. Overall, we want to give you all an understanding of what we're doing with the State Health Improvement Plan. And we'll really get into what that means a little bit further into the presentation. But for right now, we want to introduce you to those folks who will help us describe this process. Some of the community members who were engaged with us throughout the development of the SHIP. All right, so now you all have had an opportunity to meet some of the folks who will give us some feedback throughout the course of the presentation. We apologize, there's a sound issue going on, so there was some sound there, but it's unfortunately not playing. However, every video that you will see does have subtitles. So let's talk a little bit about what the State Health Assessment and State Health Improvement Plan actually are. So a state health assessment, or a SHA, is a process by which we gather information to describe the health of a population. So it gives us a good understanding of what does the state of health look like in Louisiana, right? We also take into consideration local and cultural values. It describes the impacts of those factors on health. We also look at describing health inequities around the state with various populations. And we look at assets and resources that may be available to help us impact various health issues that arise during the process. So once again, the State Health Assessment, or the SHA, really is a snapshot. What does the state of health in Louisiana look like right now? Where are the issues? What do we need to contend with? And that ultimately leads us to the State Health Improvement Plan, which we refer to as the SHIP. So that is the action plan or the guide that's based off the results of that initial SHA, right? It's a community-owned plan, which is why we wanted to make sure you all see the involvement of the community members. It's not something that we do ourselves here at the state or with the Louisiana Department of Health. It really is something that's community-driven and owned, and they inform us of what we need to focus on in order to better health within their individual communities. So it's a collaborative effort, a collective impact. And we use that to help develop the strategies, objectives, and goals to address those health issues and hopefully, ultimately end up with some type of improvement. Now, when we engaged initially with developing the SHA and figuring out how do we want to capture what the state of health looks like, we really wanted to make sure that there was a focus on health equity. And so we used the Prevention Institute's health equity framework to build out not only the SHA and how we were going to look at the data, but also the SHIP ultimately. And so this framework, I won't get into a lot of detail about the framework, but we'll go over some of the components because our SHA is built around these. On this document or this diagram on the left, you'll see the box to the far right that says health inequity. So what we want to do first with this framework is identify what are the health inequities that we're seeing. The SHA helps us to kind of point to those things and then work backwards from those. Okay, what medical conditions lead to those health inequities? And what health exposures and behaviors ultimately lead to those medical conditions? And then finally, what foundations of community health lead to the exposures and the behaviors? And the foundations of community health are really equivalent to the social determinants of health. Some of you may be familiar with that terminology. But it's just looking at the overlap of opportunity, places, people, healthcare, and other foundational components within the community that impact a person's health. I know that this document, the diagram on the right is a little bit small, the text there, but it kind of gives some examples of things that we're talking about for foundations. So if we're looking at how people may impact foundations of community health, that's the social networks and trust that is built amongst people within the community. Norms and culture may be another example. We're talking about places, we're looking at parks and open spaces, for example, housing within the community, air, water, soil. Equitable opportunity, we're looking at things like education and living wages. So we know that all of these things ultimately have an impact on the health and well-being of a community and individual community members. So we wanted to make sure that we took all of these things into consideration when building up this SHA. Ultimately, we launched a dashboard. We completed the SHA and launched the dashboard in March of 2021 that is updated annually. And if you ever want to check that out, you can go to www.louisianasha.com. We'll also drop that link in the chat. And there you'll find framed around this framework, built around this framework, you will see all of the issues, the health issues that arose during our review of the data. And so you'll see foundations of community health, demographic information, behaviors, and exposures, and medical conditions, all listed there with various data points that you can look at. An example of that would be one of these visualizations, which is a map of internet access. We know that internet access and access to Wi-Fi does have an impact on numerous things that can affect health, education, access to employment, health literacy, information, right? So the more broadband or internet access that people have, the better it impacts health outcomes. So we have a map here that just shows these are the households with access to internet. So that's an example. And then we do that by region. So all of this information is broken down by regions, and you can look at it at the parish level as well. On the right, you see some charts that we have, diabetes prevalence by race and ethnicity, diabetes prevalence by education, by income. So you see those different factors that we looked at where we can determine, okay, are there health inequities when it comes to race and ethnicity? Are there health inequities that we can see around education for these different indicators of health and income? And that helps us to inform the strategies and even potentially the partners and resources that we need to either address or move into a community in order to impact those health issues. So this is why the data and the way we frame the data early on in this process is very important. And with that said, I'll turn it over to Dr. Negatu to start talking a little bit about what we did in the report and ultimately how the SHA led to the SHIP.
Thanks, Robert. So as Robert shared, the SHA Dashboard is really this data hub that highlights inequities related to health outcomes and social determinants of health here in our state. However, we knew that that wasn't enough, and that in order to create an equitable plan and in order to ensure that it was reflective of the community, we had to talk to community members directly. So we partnered with the Louisiana Public Health Institute to conduct one-on-one interviews with community members from across the state, representing varying geographies and demographics, to capture their perception about health-related concerns. We then compiled that qualitative data and findings into our SHA report that can also be found at www.louisianasha.com. And so the report is really meant to complement our dashboard, but most importantly, to connect our community's voices with data visualizations and provide a more nuanced understanding of the impacts of various inequities on varying population. And so the quotes on this slide just highlights the impact that natural disasters have on housing instability. Community members share that people who are most vulnerable to housing insecurity after a natural disaster occurs are often those with disabilities, those with behavioral health concerns, people living on fixed income, and also individuals who survive domestic violence. Next slide. Now, after we analyzed all of the data we compiled, and after the completion of the SHA report, these 4 priority areas really bubbled up to the top. And so in no particular order, they're behavioral health, chronic disease, community safety, and maternal and child health. We present these recognizing they're very much interrelated, and we crafted them to be broad by design to allow for specific goals and strategies to be determined as we move through implementing the SHIP over the coming months. Also, while the plan is aiming to improve health outcomes, we intend for it to include strategies that address root causes of these issues, including the foundations of community health, health-related behaviors and exposures, and medical conditions. Additionally, the plan is a health equity plan, so strategies for objectives will focus on addressing inequities amongst vulnerable populations. Next slide. Here, we created 4 priority area fact sheets that can be found on the website as well. You can review these just to find out the key findings from the SHA process. Next slide. And so next, I'll walk through our SHA SHIP engagement process and framework that guided our work. But before then, we'd like to share another video from our community partners.
Okay, and what I will attempt to do this time is read the subtitles, just in case anybody can't actually see the subtitles. So bear with me 1 second. Let me get this ready. Okay, so the question is being asked is, we asked our community members what has been your overall impression of the SHIP community engagement process? So Brad says that's a good question, and his overall impression is that it's been fantastic and one of the best things he's been involved with when it comes to the Louisiana Department of Health. He thinks it's moving forward into the future. It's best practices. It's taking what we call at LPHI smart deliverables. In other words, strategies, measurables and he forgot the rest. But the key is that the ship is doing that. It's completely engaged in the community process. It's talking to me and my peers, my colleagues, and the clinicians that are doing the community work and connecting that to the overall goal to help improve the health and public health of our citizens in Louisiana. All right, now I hope that didn't come across a little weird with me kind of reading on top of it. But Brad had some really good feedback, and I hope that everybody could hear me clearly. Back over to you, Dr. Negatu.
Thank you. So we approached community engagement utilizing the evidence-based NACCHO MAP process, which stands for Mobilizing for Action Through Planning and Partnerships. This framework is an evidence-based framework that can be used to identify community health priorities, identify resources, and help to guide action steps towards improving health outcomes. It's a strategic planning process to achieve health equity and emphasizes the vital role of having broad partnerships and community engagement, the need for policy, systems, and environmental changes, and alignment of community resources towards shared goals. Next slide, please. So seen here, we have a list of our entire community engagement process that shows the number of ways we were able to solicit feedback to better understand our state's strengths and weaknesses. Starting from the top, we conducted 9 regional meetings between June and July 2021 to inform outreach for our statewide survey and to identify SHIP priority areas. From there, we disseminated a statewide survey to collect perceptions of the foundations of health during July through October 2021. Then we moved on to interviewing our community members and public health system leaders to contextualize findings from secondary data that was found on our SHA Dashboard and to further understand responses received from our survey. Lastly, we conducted a second round of regional meetings to publicly vet the SHIP priority areas. And so in total, we were able to reach nearly 6,000 Louisianians. Next, we will share more feedback from our community partners on the SHA SHIP process. And then Robert will share how our SHIP work groups worked in partnership with us to identify assets in their communities that could be leveraged, as well as how they assisted in creating shared goals and objectives for the SHIP.
Thank you. And we have another community member video that I will read on top of in the voice of that community member. The question we asked them was, what benefits do you see in the SHIP process? The benefits that I see in the SHIP process is that it's allowing real individuals to give a real perspective on things that are needed in our state. And when I say real people, I'm saying these are individuals that are not being paid, that are not in an elected position, that are really speaking truth to power. They're stating what they see a need is, such as myself. I speak about individuals with disabilities and our limited access to behavioral mental health services, as well as fetal maternal health services. And it allows the group to actually talk about what this looks like and how we can actually fill that void realistically within the state of Louisiana, without having to divert resources to another state or lose these people to another state, if you will. So I think that these are meaningful conversations that need to happen, and I just wish that they would have more. And that was Ms. Karanda giving us great feedback and great advocacy. And I'll talk a little bit about these SHIP work groups. So the SHIP work groups are the groups that we brought together to actually engage on developing the SHIP and implementing the strategies ultimately. Everyone that you've seen in the video is a part of one of those SHIP work groups, right? So All of the work groups are open to the public. They're all conducted via Zoom. We try to make them as accessible to people as possible. The work groups have identified a community lead for each priority. So Dr. Negatu mentioned that we had behavioral health, chronic disease, community safety, and maternal and child health as our priorities. Each one of those has a lead. We've had a total of about 34 meetings across all of those priority work groups. Just talking about different things. You'll see some of the things that we discussed in the items that we developed in those meetings a little bit later. Each of the program offices internally at the Office of Public Health identified a co-chair for the group. So we wanted to make sure that this was community owned, as I mentioned before. So the community members are the folks who are the leads. We didn't want people from the health department leading these groups. We wanted our chairs to be community members, and we have a co-chair to give us that internal perspective as well. Some of the things they've done, they've reviewed data to identify root causes of some of the health issues that were identified during the SHA. They received training on how to create SMART objectives, which the SHIP contains. We have to know that we're tracking things that are actually attainable and that we have a way to determine whether or not we're successful. They created shared goals and draft objectives. They also went through an asset mapping process where they identified assets within the community that can be leveraged to help ensure the implementation of the SHIP. So they've done a lot of things. These are just some of the things, but they've done a lot over the course of the last year, meeting several times. So we're really proud of that group. They've done excellent work. This is an example of kind of how we started off with the group. After determining what the priority areas were, we wanted to see, okay, what are the identified resources or assets within the communities across the state that could help us address these priority areas? So we went through an asset mapping process, and we looked at 4 different things as assets: programs, people, places, and policies across the state that may impact those priority areas that we mentioned earlier. We got everybody together in the group in a real simple process. Get on the Jamboard, put sticky notes on the Jamboard, and tell us what are the programs that may impact chronic disease. What are the people or the folks that we need to be aware of, the subject matter experts that may impact this priority area. And we got them to list that stuff. Same with places and policies. Ultimately, the way this helps us is like this. Here's an example. Right here, we see a map that you can find on our dashboard of women who have had birth within the past year. This is how the data is laid out on the dashboard. And for each parish, you can see a density or a color. The darker the color, the higher the percentage. And so by looking at where the highest percentages of are people that are giving birth, and then looking at where the identified assets are, we can determine if there's a gap in between the need and the available resources. So if we look at these parishes on the eastern part of the state, right, we can see that there's a high percentage of births within the past year, but not a lot of identified resources or assets. So that can ultimately impact our strategies, right? That can let us know, okay, we have a need there, but not a lot of identified resources. How do we address that? And even if there are resources there, but they have not been identified by the community, that also can inform a strategy. Because if there are resources available that people don't really know about, our strategy may need to be centered around educating people about what's available. So it's still good to know and go through this exercise, even if people don't know all of the potential resources that are there, because it will allow us to develop appropriate strategies. So that's why that's important. And that's how one of the ways that you kind of leverage data and understand what you need to present as far as data is concerned. Wanted to show you all this tool, which is after we went through and looked at assets, we started to begin to walk our work groups through thinking about potential partners and strategies to address those assets or gaps in assets. So this is an example of what we did with the community safety group, right? Looking at the draft goals around reducing violent crime and improving community readiness and resilience. Okay, what are some of the indicators that could lead us to that? And who are some of the partners and strategies that are already in existence that can help us reach that goal? We also wanted to look at the geographic area. Is this strategy something that's implemented statewide? Is it a regional thing? So all of these things are things that we took into consideration when we were trying to figure out, okay, how do we need to address the gaps in assets? And we wanted to make sure that the community at every step of the way had the input and was driving us in the direction that we needed to go, which ultimately led to developing the goals and objectives. So your goals and objectives, in a nutshell, are your action plan, right? It's telling you exactly what you want to do and by when. So our process looked similar to this diagram. That brainstorming piece, which you all saw with even the asset mapping, with collecting that information from the different community groups through the different methodologies. That was the brainstorming, the teamwork, bringing everybody together and figuring out what should the goals be? What should the priority areas be? What are the assets? And then you go into the planning piece. How are we going to address those? Checking, collaboration, and then developing the objectives. So when we were developing the objectives in conjunction with the community, there were several different things we wanted to take into consideration, right? For goals, we wanted to think about, okay, what are our priority areas? What is the community saying about this? What are the health inequities or the disparities that we've already identified that can help us establish whether or not this goal is appropriate? And then looking at objectives, we wanted to think about like SMART objectives, right? Can we measure these things? Do they specifically address the goals? Are they something that we can actually achieve? Are the objectives relevant to the goal? We don't want to have a goal that is totally separate from the objective. Otherwise, no matter how hard we work, it won't improve the goal. And then we started looking at strategies and activities, right? We based that on who are our available partners, what programs exist, right? And so part of that was that asset mapping process and also that spreadsheet that you just saw. We wanted to look at indicators, which were driven by what data we have, what sources are available, what is the trend in the data telling us, where are we currently, and what do we want to do, what is our target? And then we also looked at alignment. With these objectives, with these strategies, with these indicators, what are they doing nationally about these? Is there some alignment around those? Are there other agencies within the state that are working on similar things that address these priority areas? Are they internal things that we're working on at LDH that we can provide support with for the community to address? Right, so all of these things we took into consideration when we were working with the groups. And we would often meet, I think some of you who are on this call right now have been to some of our meetings, right? And so we would meet with our groups twice a month and talk about very important things. One of the most important discussions that we had around this was the following slide, right? Would you rather wear clown shoes every day or wear a clown wig every day? And for those of you who can't see this slide, there's a picture of a clown shoe and a clown wig. And basically we did something like this every meeting, just to lighten the mood, just to get people relaxed. And it was an icebreaker. So people had a lot of fun with this. We got some really cool, interesting answers around why people would choose that. But this is one of the ways we engage the community, just by not being too serious, but understanding that people need to feel comfortable to be able to address the issues that we need to address. So I'll turn it over now to Dr. Tewabetch for the actual real stuff that we asked.
Thank you. So yes, as Robert mentioned, we really did try to provide a space where our community partners felt comfortable and free to speak candidly about some important issues. And so we always work towards including interactive activities whenever possible. Here are results from an interactive activity that we conducted with our chronic disease work group. For this exercise, we asked, based on the data, what areas of chronic disease should we focus on? And so some of the ones that floated to the top or have a larger font were cancer, diabetes, obesity, etc. Next slide. And then once we identified those goals, we worked towards identifying shared objectives. And then we went on to ask members if they agreed to including some of these objectives for their particular priority area. So for the chronic disease work group, we identified increased access to care, and we asked members if they agreed or disagreed to including this as an objective for the priority area. Next slide. We did the same for all of the objectives. And so for this objective, it was reducing cancer rates / improving screening. And here you can see 22 members agreed to include it, while 5 disagreed. Next slide. Here are the overall SHIP priority areas and goals, and I'll just read them really quickly. For behavioral health, the identified goals were to reduce barriers to behavioral health services and reduce deaths from drug misuse. For chronic disease, our members identified increasing access to care, reducing diabetes rates, improving cardiovascular health outcomes, promoting healthy weight, and reducing cancer rates and improving screening. For community safety, we're looking towards promoting healthy and safe environments, improving community readiness and resilience. And then lastly, for our maternal and child health work group, we identified the goals of improving birth outcomes, improving child health, improving maternal health, and improving reproductive health. Next slide. And again, once these shared goals were established, we then identified the SMART objectives in partnership with everyone and asked if the identified objectives align with the goals. And so here we asked our chronic disease members, do they believe the proposed objectives align with the goals? All of the members said yes. Next slide. And then lastly, we asked members if they approved of the proposed objectives. And again, overwhelmingly, they agreed and said yes. Also, during our SHIP work group meetings, we do like to provide an opportunity for our partners to respond openly. So we would often give the opportunity to ask an open-ended question and for them to provide us with feedback. Next slide. Now, once we received all of our feedback on the draft objectives, we worked towards tailoring our SMART objectives to better align with best practices, but also with efforts already being done throughout our state. And so we worked towards aligning efforts with program offices here at LDH, the LDH business plan. We combed through some of our state agency strategic plans and saw where we can align with their work. We looked at best practices like Healthy People 2030, and then we also worked with local partnerships like the local health departments like the New Orleans Health Department. Next slide. Now, as we look towards implementing the SHIP, we just wanted to share this very high-level overview of the attributes we believe will assist in effectively implementing the State Health Improvement Plan. And so those attributes include having an explicit focus on primary prevention, ensuring there is cross-sector collaboration, making sure that data is being shared widely and freely, as well as making sure that there's an intentional focus on elevating the voices of those with lived experiences who are the closest to the inequities and disparities that we're seeing and working towards improving. And I will hand it back to Robert.
Thank you. And we have another community voice video coming up, which I will narrate once again. So for this one, we asked community members, the work group members, what are you most looking forward to over the next year? Really excited just to follow up on our goals and our objectives. Really looking forward to meeting up with all of the other work groups just to see how we can all collaborate and make Louisiana a safer Louisiana. So that's the most exciting part for me, is just to get started on working towards our goals and objectives. And that was Ms. Ashla Burgess, our community safety chair. So I'm going to talk a little bit about next steps, but before I talk about that, I also want to give another thank you and shout out to our work group members. If any of them are online right now watching this, we thank you so much for your participation. We could not have gotten any of this done without the community engagement. And I also wanted to reiterate or point out that our work group is comprised of individuals from all over the state. So they're not all located in one place, which is why Zoom is a useful tool, because it allows us to meet in different locations. But we have folks from all over the state in various sectors, all the way from healthcare to insurance to folks in education. So we really have a broad, wide-reaching, diverse group of community members involved in the work group. So I wanted to say thank you again and highlight them just once more. Now, our next steps that we'll be going through. The first and most important thing I wanted to talk to you all about is the launch of our SHA Dashboard, which will be forthcoming. And similar to the SHA Dashboard that we showed you earlier, this will be something that's interactive, that houses the data specifically focused on the SHA this time, as opposed to all of the data that the SHA shows. So this is going to be focused around chronic disease, behavioral health, community safety, and maternal and child health. And all of those objectives that we talked about, those indicators that we'll be tracking, will be housed on this dashboard. And you'll be able to see what our progress looks like. So we wanted to make sure that this SHA is transparent and dynamic. It's not just sitting on a shelf somewhere where people can't see and can't easily determine how well we're doing. You'll be able to go through it at any time and hold us accountable and make sure we're following up on the things that the community says are important. And you'll be able to give some feedback, just like you can on the SHA dashboard. You know, there's an area there where you can provide feedback and your thoughts. So we always like the community to be able to be engaged and find this useful. So that will be coming up late summer, early fall, potentially for this SHA dashboard, for the SHA dashboard to be released. And what we're also going to do is we're going to meet, we're going to have a meeting soon to talk about interconnectivity and how to develop strategies that address health equity. An example of some of the things we'll be looking at during some of the upcoming meetings are graduation rates and suspension rates among students with disabilities, for example. We know that there's a disparity and an inequity there where there's higher rates of suspension among that particular group. So one of the things we would be looking at is strategies for how to address that. And this SHA dashboard will also display the strategies that we engage in to address those inequities. We'll be continuing to look at additional ways to partner with community members, with other sectors. Now, our big focus is making sure that the SHA is not just focused on one thing, right? It can't just be the health department. We have to make sure that nonprofits are involved, healthcare, law enforcement, community, business. All of these sectors make up the public health network, right? These are the things that impact people's health. So we all need to have a spot at the table and participate in order to make it the most effective it can be. And everything is still going to be centered on health equity, right? Individual and team growth, systems and policy change, community level work and partnerships, all of these things ultimately impact how healthy our communities are. So the better we do that, the more engagement we have, the more likely it is that we have improved health outcomes down the line. And before I close it out, I have one more video that I want to share from our community members. So this time we asked them, what would you say to anyone who may be interested in participating in the SHA? If you're interested in participating in SHA, please do so. It does not take a whole lot of your time or resources to be able to have a voice and speak. We need you to be able to share with us, what are your insights? What are you seeing throughout the different regions in the state? And bring your expertise to the table so that you can help us to influence the outcomes that we need to help us move into a healthier state by 2030. It's one of the things that we keep focusing on when you're looking at Healthy People 2030, healthy initiatives for the state of Louisiana. And so if you want to participate, it does not take up a lot of time. There isn't any homework to do. We just need your voice. We need your expertise so you can share with us so that you can be a part of influencing a positive change for Louisiana's healthcare. And that was Karen Weibel, who is the chair for our chronic disease work group. So, we hope that you can see from our presentation before I go to the closeout slide that community engagement and feedback is important to us. That's something we would, not be able to contribute or complete or conduct an effective SHIP without community engagement. So we welcome you all to join us. If you would like, we would love for you all to connect with us so we can create more together and learn how to, create a more equitable Louisiana. If you're interested in staying updated, please text. We'll drop this in the chat as well. You can text SHA SHIP, SHASHIP to 22828. If you text that, that will sign you up for our newsletter. So you'll receive information about how to participate. And once again, that is SHA SHIP, SHASHIP at 22828. We'll also drop a link in the chat for you to fill out a form that will allow you to enter some basic information, your name, your email, phone number if you would like, and what working groups you would like to participate on. Real simple form. You fill that out and we'll link you into the upcoming activities that we have with the work groups. So if you want to learn more about clown shoes, wigs, community engagement, any of those things we're working on, feel free to join us. And with that being said, I would like to say thank you so much for giving us some time to just share with you all. We're always excited to be able to share what we're doing because it really highlights the type of community we have here in Louisiana. We have a very engaged community that cares about one another. And it's really great to see everybody coming together to work together to develop the SHIP. Dr. Negatu, I'll let you have the last words.
Or if you guys would like to see Robert Hines perform and sing, that's a great way to. I just did want to clarify the anticipated new launch of the SHA Dashboard is this fall.
Yes.
So we anticipated in the summer, but the good thing about the SHIP, it is dynamic. And so we want to refine things. And as things come up, we have the ability to make sure it's right and postpone it, but we will have it launched this fall. Thank you, everyone.
Absolutely. Thank you all so much.
Thank you, guys. And Dr. T and Mr. Hines, if y'all send us that information, we would love to include that in our monthly newsletter. I know KJ is chomping at the bit. So please
Yes.
email that to KJ and we'll get that in there.
Wonderful. Thank you.
Thanks, Bambi. Thank y'all so much. It was a great presentation. I personally am a huge fan of y'all's icebreakers. I thought that I knew Dr. Negatu until I realized I didn't know her. It was one of those sessions where you were asking which one sounds like her, or the two truths and a lie, or something of that sort. And I was like, what? So I personally am a fan and enjoy them. But let's see if you guys have any questions in the question and answer box. Okay, it seems as if James Mitchell, said transportation is a huge factor in accessing healthcare. Wait 1 second. Okay. Will LDH be willing to work with GACTA and DLTD to improve transportation options in this state?
That's a great question, James. So we do have a couple of objectives focused on transportation that we partner with folks from DOTD on around, improving the safety of transportation. So one dealing with pedestrians and bikes, and the others dealing with, vehicle crashes. And so, yes, we You're absolutely right. Transportation is definitely a huge issue. But there's also the issues of the safety issue. So all of these things are kind of cross-cutting. So yeah, DOTD is definitely involved. I don't know that we have spoken to anyone in particular from GACTA. Dr. Negatu may have, or we may have someone involved in the work groups, but we haven't done any collaboration with them.
And Ms. Brooks provided her email address. I'm unsure if there was a question or a response earlier that I may have missed that you guys were answering, because I did see y'all were in the chat and in the questions while y'all were taking turns. So Ms. Brooks, they did receive it. And Dr. Mitchell said 2 different problems. We can't walk to the doctor, which is
Absolutely, absolutely true. Which is why we wanted to make sure we didn't have simply a objective focused only on pedestrian safety, but also one focused on, vehicles. And so there also is an opportunity with us engaging with DOTD to look at potential strategies about, for instance, your point, transportation to healthcare, right? So there's a lot of opportunity. The first thing was just to get folks at the table and start engaging. So that's one of the biggest issues is around transportation. And so we're happy to have them available.
yes. So once again, we just want to thank you both so much for sharing with us. Great presentation as always. And
Thank you.
for anyone else, our next session will be on why didn't they just leave, in their own words. And it's a panel discussion on disabilities and barriers to evacuating. Will begin at 2:10. And as always, you're always welcome to remain logged in during the break, and we'll see you guys then.